Ready, Dr. Krishna?
Yep.
Alright, 3, 2, 1, and go. Wait, no, go.
Hello, everybody. Good evening, and hope you're enjoying the summer. Today we have a topic that has some cutting edge treatment, and it was a topic that was by popular demand called PTSD, post traumatic stress syndrome. It's a common topic in medicine. It's especially common after we've had so much military deployment into many military areas of the world, such as Afghanistan, Iraq, and the Middle East. We have many soldiers coming back home with a diagnosis of PTSD. But PTSD is a fairly common problem that occurs to people who have experienced frightening, mentally altering, and physically altering, and emotionally altering events in their lives. It can occur from exposure to being in the military, from war torn areas, or being a civilian in war torn areas, or unfortunately, if you've had some physical violence against yourself, emotional violence against yourself, or even sexual violence against yourself, that can result in PTSD. PTSD usually results in a physical response where the patient feels some symptoms such as palpitations, anxiety, cold, clammy sensation, and some emotional symptoms of emotional lability where they cry, where they can uncontrollably laugh, or have an inappropriate response to a question that may be asked by an examiner. Additionally, there is a non-emotional, non-physical attribute to PTSD, where patients develop some form of nightmares, dreams, and vivid hallucinations. This is not something that can be easily quantifiable. It usually occurs to those patients who have had significant prolonged exposure to the traumatic or anger-producing event. So if you have been in a situation where you're in a war-torn area, or you've been in a situation where you've been homeless for a long time, or living in a refugee camp, or serving in a military environment in a war zone, that if that occurs for months and years, then those kinds of patients are at risk for losing touch with reality and having episodes of unusual thoughts that intermingle throughout the day in their brain, and unusual events that cause severe emotional lability. The problem with PTSD is that it changes the personality of the individual. Family members tend to realize that the person is no longer the same person they knew years back, and everyone feels helpless. For the most part, the diagnosis of PTSD is done first by your own doctor, who can take a history of what traumatic event may have occurred. And it's important for you as a patient, or your friends or family who you may want to advise to go and get checked out for this, to be very honest and frank with their physician about potential tragic events that may have occurred in their lives that have caused these symptoms, or could potentially be related to these symptoms. So a good history by a physician is important, and a good history given by a patient to a physician is also important. The next thing that's usually very important in diagnosing PTSD is trying to make sure that there's nothing else that can cause these symptoms. The most common diagnostic tests that are done are some cardiological tests to make sure that the palpitations are truly not related to any heart problem. So an EKG and ultrasound of the heart are common diagnostic tests that are done. And if the patient is having unusual brain symptoms such as fogginess of thought, nightmares, hallucinations, or mood ups and downs, then an MRI of the brain would probably be appropriate. An electroencephalogram of the brain would also be beneficial. that can help make sure that there's no brain tumor that we're dealing with or any seizure-like activity that's happening. Once all of those diagnostic tests are negative and the patient's clinical findings are truly related to a diagnosis of PTSD because of a traumatic event, the treatment is the next step. Treatment can range from antidepressant medications to vitamin therapy to psychological therapy to try to uncover the depths of which that traumatic event has occurred. And also, now we have had some success of late with a ganglion block, and this is called a stellate ganglion block. And this is the reason why I wanted to discuss this topic today, because it's a revolutionary treatment that has recently been available to the public. It's also something that is useful to know if you have a friend or a family member suffering from PTSD, so you can at least advise them what to do. This is a nerve injection that is given just above the collarbone, and it blocks a nerve that travels from that area of the collarbone to the neck and sends impulses to the brain. Somehow, miraculously, it reduces the symptoms and the vivid flashback phenomena of PTSD for patients in a significant, perceivable way. And this has been shown through various studies done through the Veterans Administration for patients who have war veterans who have come back from war-torn zones. So I would like to make sure that everyone understands that there's a new, fairly reliable and fairly successful and easy procedure to try for patients with PTSD, and that is called stellate ganglion block. And this is a ganglion block. It's done under an X-ray machine. It can be done once every couple of months, and it really has a very low risk profile. We'll put up the risk profiles afterwards on our chat after this topic is discussed, so that you can read through it. And if you have interest in pursuing this kind of a treatment for your family member or somebody, please let us know. We'll be able to recommend to you the types of physicians in your area that could potentially help you with this. So with that, let me hand over the mic to the chat room to see what questions you may all have with regards to this condition, and if you have any specific thoughts on PTSD and its treatments.
Doctor, I often wake up screaming, crying, etc. during sleep. I hear and see war, bombs, etc., yet I was never in the military. My trauma was actually caused by domestic violence. Is there any advice you can give on how to proceed? I'm already seeing a therapist, but I'm wondering what else can be done.
Well, I think there's a lot of overlap between PTSD from domestic violence to PTSD from war-torn areas or war zones. It results in the same problem. You're definitely exhibiting signs of PTSD of a person who would have been in a war-torn area. Domestic violence is like being in a war-torn area on a daily basis. I do believe that if you have tried therapy for at least 6 months, have not found any significant improvement in your symptoms of night terrors, these are called night terrors, what you're having, then it is appropriate for you to seek a consultation with a pain management physician who would be willing to try a stellate ganglion block for PTSD. If for some reason you're unable to find somebody through your primary care physician's office, please let us know through our chat room. We'll be able to help you get somebody in your area.
I seem to be suffering from false memories. Is this something you're familiar with? Because the doctor I'm currently speaking to doesn't seem to believe that this is related to PTSD.
Well, that's an interesting question. False memories are memories that are usually created by patients to suppress painful events that have occurred in their lives. So what happens is that it's almost like creating a umbrella over the old painful memory, so that you don't recognize the old memory that is very painful underneath the umbrella, but rather start creating a new story around it. And unfortunately, physicians sometimes don't realize that this is an event. So that's why I would suggest that if you do have false memories, I would suggest that you aggressively pursue the treatment of false memories with a psychologist who is willing to delve deeper into what may have caused your subconscious to create these false memories. Additionally, seeking psychiatric consultation does help by alleviating these false memories with an antidepressant, as those seem to alter the chemistry of the brain, resulting in the suppression of the false memories and allowing the psychologist to help work with you longer to delve deeper into what may be causing those false memories.
Are you able to get a ganglion block immediately, or is it something that you have had to be in therapy or have certain prerequisites in order to qualify for?
The utility of ganglion block in PTSD has been relatively new. It has been primarily used in the military purpose, so the criteria are in flux. However, that being said, using a common sense approach, one of the things that are probably going to be important are to make sure that you've tried some legitimate psychological therapy for at least 6 months to show that there's been some improvement or no improvement. If there's been no improvement, that's fine. Then you would just explain that to your doctor, that this is the reason you want to pursue a ganglion block, and that would be the reason to go and get it. If there has been a significant sustainable improvement with the psychological therapy, then I would advise you not to pursue that ganglion block at this time.
Doctor, I understand you're a neurologist, but I'm still wondering if you have any inkling or opinion as to why PTSD affects people so differently. Why do some people exhibit self-sabotaging behaviors, others false memories, etc.? Does it have to do with the type of trauma experienced?
Yes. So from our experience in treating patients with PTSD who come to us to make sure that there's no neurological condition causing these associated symptoms, it has been that PTSD is usually associated with the types of symptoms exhibited by PTSD patients usually is exhibited with the length of exposure to the traumatic event. It's also associated with the type of traumatic event. If it is from an immediate family member or a loved one versus if it's from a random person on the street corner. Such as many patients who have had motor vehicle accidents or industrial accidents do get PTSD. So if you injure yourself on the job and you fall and you work and you hurt yourself and you hurt your head, you can get PTSD because you relive that fall or you relive that event in your mind, and that can cause imprinting in your psyche, resulting in PTSD. That imprinting is a one-time event which is short-lived, so it's easier for us to treat that over time. With regards to other types of PTSD, so if you were deployed in a military environment to the Middle East for 3 years in a war zone, out on patrol every day and every night, and had hundreds of your troop members killed or in some way shot at, you would not be so easy to unravel that PTSD in your case, in that kind of a case, and that would be a much more in-depth psychotherapy and would probably end up needing some of these newer novel therapeutic interventions like ganglion blocks. So once again, to go back to your original question, you're right. the types of emotions and clinical features are usually very dependent on the length of exposure to the offending agent and to the depth of exposure to the offending agent, and from where that offending agent is coming from, whether it's a family member or a independent random person on the street.
What do you think about the idea of using quote-unquote magic mushrooms or LSD to cure PTSD, which has become increasingly common?
Yes, there are some thought processes out there of magic mushrooms and mushrooms and or LSD for severe PTSD. They've used it primarily for severe PTSD, where there's been prolonged exposure to the offending agent, where there's been prolonged, deep-rooted psychological changes that affect and live and sustain a normal life pattern. And I have not seen the data from that, and I've only heard some anecdotal reports. So I don't want to say that it doesn't work or it does work, but I can only say that the anecdotal reports that I saw, it does work. However, I have seen some of the data with the ganglion blocks that have been done through the Veterans Administration who had significant amount of traumatic exposure in war zones, and that has resulted in a really great positive outcomes. So with the ganglion blocks and the sympathetic ganglion blocks, I believe there's some real data that can help. With regards to the LSD and magic mushrooms, I'm not sure about the positive data. I do know that there's a negative outcome that can occur with LSD, where you can be left with long-term hallucinations and vivid dreams, which are dangerous. So proceed with caution if you're planning on that route, because the side effects do seem to be something that can be left lifelong. Unlike the ganglion blocks, they're very safe, 5-minute in and out procedure, and it can work remarkably.
Is it possible to develop new triggers over time? I find that things that didn't prior bother me are suddenly causing me to have panic attacks and other general sensitivities.
So it's not the issue of having new triggers. That's actually a common question patients do ask us. It's not the idea of having new triggers. It's the idea of having triggers with a common denominator to your offending event. So if you have a trigger with a common denominator where you had and I'll use a hypothetical where you were in a war zone and you developed PTSD from prolonged exposure to a war zone because you lived in this refugee camp, and the refugee camp had certain tastes, certain smells, certain attributes to it. And if you had similar events of taste, smells, and attributes exposed to you while you were here back home, you would probably find that would be a common denominator symptom that would trigger the underlying bad memories that were present while you were in this refugee camp. So that's why these are overlap triggers. We call them that in conventionally we do call them overlap triggers, but they're actually overlap memories that seem to provoke an uncovering and unmasking of the original underlying offending issue. And it's important to be cognizant of the same, so that if you know what those memories are, you may want to avoid some things on your daily routines, so that it's not something that provokes the events of palpitations, cold, clammy sensations, and emotional lability or panic-like events. We'll do one more question and call it a day, guys.
How should you approach it when a person is your trigger, even if they're family? Is the best thing to eliminate them completely, or should you, through the help of a psychiatrist, psychologist, etc., work through limiting how much they quote unquote trigger you.
Right. So, a person being a trigger is not uncommon. It is important to understand that a person a person, if it's a close family member, is difficult to avoid for the most part, because you'll see them on a fairly regular basis. The easiest way to approach that is probably to do some form of psychotherapy on your own, but group therapy between the person who is a family member and yourself with a psychologist to mediate what may be happening between the two of you that provoke these events from occurring is probably more bang for your time, so that you can get a better outcome. And that would probably be worthwhile, going once a week for a few weeks to a counselor, so that they can uncover what are the dynamics that are occurring between yourself and the family member that need to be resolved, so that that triggering mechanism is no longer an event in your life. So thank you very much, everybody. It was a nice, exciting topic. I'm happy there was a lot of questions. I'm sure there are more questions that you will have. Please post. We'll endeavor to get you out answers in the next day or so. And also, if you have any interesting topics that you'd like us to discuss on the next podcast, please let us know. Have a nice evening.